Hi, let's look at the indications for myomectomy. So, myomectomy is a surgical removal of uterine fibroids, also known as leiomyomas, with preservation of the uterus. So, it is called myomectomy because it is derived from the word leiomyoma. The myoma here indicates the benign tumor, and the ectomy here indicates surgical removal. It is the treatment of choice for symptomatic fibroids in women who wish to retain fertility or preserve the uterus for other reasons. The aims/objectives of myomectomy are to relieve symptoms caused by fibroids, to preserve reproductive function and improve fertility outcomes, to avoid hysterectomy in women desiring uterine conservation. So hysterectomy, on the other hand, is surgical removal of the uterus. So we have symptomatic indications such as menorrhagia, that's heavy menstrual bleeding leading to anemia unresponsive to medical treatment. We have pelvic pain or pressure symptoms due to large fibroids. Here there is usually urinary frequency, urgency or retention as a result of bladder compression, constipation from rectal compression, low back pain or pelvic heaviness. Next is dysmenorrhea, which is painful menstruation due to submucous fibroids. So these are fibroids beneath the endometrium. Next is reproductive indications. Infertility. When fibroids distort the uterine cavity, there is interference with implantation or it blocks the fallopian tubes, affecting fertility. Recurrent pregnancy loss, that's miscarriages, due to submucous or intramural fibroids affecting the endometrial cavity. Desire for uterine preservation. In women who are yet to complete their family or wish to maintain their uterus for psychological or cultural reasons. Next is size and growth related indications. So, rapidly enlarging fibroid to exclude sarcomatous change. So, a sarcomatous change is a change from a benign tumor to a, a cancerous tumor. So, this is done in order to prevent such tumors from occurring. Next is large fibroid, which is greater than 12 to 14 weeks uterine size, causing significant discomfort or distorting of pelvic anatomy. Next, we have pressure or obstructive effects, such as hydronephrosis due to uterine compression. So, hydronephrosis is retention of urine in the kidneys, difficulty in defecation or urination due to large pelvic fibroid. Next is preoperative or adjunctive indication. Before assisted reproductive procedures such as IVF, when submucous or intramural fibroids may compromise implantation or pregnancy outcome. So what are the contraindications for myomectomy? Myomectomy is not indicated in postmenopausal women unless sarcomatous change is suspected. Women not desiring future fertility, here you do hysterectomy instead. Multiple small asymptomatic fibroids. Suspicion of uterine malignancy. So here you don't do a myomectomy in order to prevent metastasis of the suspected malignancy. In summary, myomectomy is indicated when uterine fibroids cause significant symptoms, interfere with fertility, or when uterine preservation is desired. It is the operation of choice for young, symptomatic, or infertile women who wish to retain reproductive potential. Thanks for listening.